Welcome, everyone, to Cyber Sangha, and apologies for starting late. Um, I am in Rinpoche 2. We're in Nepal and in Kathmandu, a lot of traffic, so apologize for that. Today we had another great day at the monastery, talking about longevity, about, the 100 years of Lopun Tenzin Namdak, of Yongdzin Rinpoche. And it was a beautiful conference, a 2-day conference that just ended. Um, so today, as we continue with these Kathmandu dialogues, we have two esteemed speakers and friends, uh, Dr. Mauricio Obón and Dr. Lorenzo Cohen. And so I'll start by introducing them. And of course, we have Tenzin Wangyal Rinpoche, who all of you know, doesn't need much of an introduction. Uh, so, but I still will do a little bit. So Rinpoche is the creator of Cyber Sangha. He's a Geshe from the Menri Monastery in India, the Bon tradition, and he's been one of the closest students of Lopun Tenzin Namdak, who's turning 100, and that's why we're here. And he had this idea that celebrating Lopun's 100th birthday, why not focus on longevity? And many of you have been following us in the last few days, the different topics from sleep to mindfulness to compassion to community. And so today, we have more about longevity from these different perspectives. And I'll start by introducing Dr. Mauricio Obón. And he's a cardiologist and he's the director of cardiology at the Hospital Metropolitano in San Jose, Costa Rica. He was trained actually in Houston at the Texas Heart Institute at the Baylor College of Medicine from 2006 to 2013. So we had the honor of having him there and actually living with us for a while he was actually reading more about Tibetan and Buddhist issues, and he got really interested in this area and in this interaction. And he's also certified, board certified in internal medicine, in clinical echocardiography and cardiology, as well as interventional cardiology, performing minimally invasive procedures in heart valve repair, heart attack treatments, and repair of cardiopathologies. He's a fellow of the American College of Cardiology, and his main focus is structural heart disease, primary prevention, and longevity. He lives in Costa Rica with his wife and 3 children, and he doesn't say this in the bio, but I know he loves surfing. And he is all about longevity and about prevention, but also about recuperating after if you need to help as well. Lorenzo Cohen is the Richard E. Haynes Distinguished Professor in Clinical Cancer Prevention and Director of the Integrative Medicine Program at the University of Texas MD Anderson Cancer Center in Houston, with whom I've had the pleasure and honor to work for 20 years. He's a co-founder and past president of the Society of Integrative Oncology and the former vice chair of the Academic Consortium for Integrative Medicine and Health. Dr. Cohen leads a team conducting research and delivering clinical care of integrative medicine practices such as meditation, yoga, tai chi, acupuncture, aimed at reducing the negative aspects of cancer treatment and improving quality of life and clinical outcomes. As most cancers are preventable, yes, I'm going to say this again. As most cancers are preventable, Dr. Cohen is also conducting research to demonstrate that lifestyle factors can influence cancer outcomes. Dr. Cohen has published more than 200 scientific articles in top medical journals and has edited 2 books on integrative medicine for cancer care and another one on yoga in health care. He's also the co-author of the evidence-based book Anti-Cancer Living, Transform Your Life and Health with a Mix of Six. So welcome. And I see that Joanna has joined. Joanna, welcome. And
Hello. Hi.
I actually met Joanna here in Kathmandu, but I imagine now you're in Switzerland now, I take it. Joanna is the founder and CEO of Longevity Center Europe innovative clinics in Switzerland and Poland, focusing on diagnostics and intervention supporting health, well-being, and health longevity. As the founder and co-president of the International Institute of Longevity, she organizes the iconic global annual conference Roundtable of Longevity Clinics, taking place at the Buck Institute in California, bringing together top global experts in the industry to discuss the future of longevity clinics as well as to establish best practices for the industry. Joanna is a member of the President's Council of the Buck Institute, as well as a judging panel of the X Prize for Healthy Longevity. In her work to design longevity programs with her team of experts, she integrates evidence-based approaches in positive psychology, neuroplasticity, sleep studies, and lifestyle medicine to help clients thrive physically, mentally, and emotionally. Welcome,
Thank you.
Joanna. Welcome, Joanna. Welcome, Lorenzo. Welcome, Mauricio. Welcome, Rinpoche. And thank you, Milos, and the whole team behind so we can make this possible. So let's take a deep breath. And we'll start. Okay. So longevity is the topic of today, and we have different approaches. We can think of it from longevity from Joanna, from cardiovascular health from Mauricio, and from cancer research and cancer care from Lorenzo. So and then, as many of the audience knows, Rinpoche has been really interested in this topic and actually have engaged with all these three people before in talks and conversations, but also in wearing some devices, and we'll get to that as well. So I wanted to start maybe from the heart. So let's start with Mauricio. Mauricio, as a cardiologist, and we think, someone today asked this question about, when are we dead? Is it the heart or is it the brain, right? And the heart, at least in many traditions, being kind of the center of everything. Can you tell us, in terms of longevity, where do you, in your ideas of longevity, do you start with prevention? Do you start with cure? Where would you put it in this spectrum?
Thanks, Ale. Well, I think particularly in my field, when I think about longevity, I do tend to think in the concept of the absence of disease, or, not ever getting to a certain point, because if we're going to talk about hurdles, the cardiovascular hurdle is the main problem if we're going to think about getting older, at least statistically. Is the number one cause of death worldwide for both men and women, and in pretty much every country in the globe. So if we're going to think about being a centenarian, or at least having a good quality of life, we do have to think about the absence of disease, never getting to that point where you need hospitalizations, interventions, and so forth. Now, the good thing about my field, though, is because it is so incredibly common, we have developed, though, the tools that if you actually get into disease, I think, as opposed to other specialties like neurology, dementia, stuff like that, we do have the tools to resolve most of our heart problems, and actually to have a good quality of life afterwards. So we do have what is called the armed portion of cardiovascular disease, which is pretty much interventional tools, pharmacological tools, if people were to get to the disease. But my main focus is pretty much from childhood, thinking about, even from childhood, thinking 50 years and beyond afterwards, to never getting to the point that you actually get disease. So prevention is probably the main topic here.
Lorenzo, so I was thinking, of course, in the area of your research and how, as you say in your bio, right? I mean, cancer is a preventable disease, or most cancers are about lifestyle. And maybe I'll start with telling us about your book, The Mix of Six, and what are these six ingredients to maintain a healthy longevity? You're muted.
I work at a cancer center, so everything, I tend to do is focused on cancer, but this actually has nothing to do specifically with cancer, and I would broaden it and talk about actually the mix of six being the six factors that will help to prevent, as Mauricio was saying, all these diseases that we as a society die of. What we call premature death. So cardiovascular disease, diabetes, different forms of dementia, metabolic conditions. These are all preventable diseases. And if you look at younger ages, the most recent statistics from the ACS that under 85, cancer has now surpassed cardiovascular disease in the United States. But they're neck and neck, right? And that accounts for 50% of premature deaths in our world just from these two diseases. Now, cardiovascular disease and cancer are not single diseases. There's many complexities around them, but the majority of all this could be prevented, let alone the suffering and the cost and the debilitation. And it's actually not very complicated. And you've alluded to the mix of six in the introduction of everybody, which is having a connection, close social network, and meaning and purpose. This larger concept of being part of something bigger than yourself is pillar one. Managing stress in your life, not that you can avoid stress, but how do you respond to stress? How do you respond to challenges? Sleep, exercise, nutrition, and then environmental exposures. And everyone knows about these areas and these topics, but what we try and approach a bit differently in our book, which unfortunately, except for a few studies in the world, haven't done yet, which is looking at them all together. We tend to manipulate one or two things in research, to say that it was the fiber in the diet that changed the microbiome, that increased response to immunotherapy, or it was the exercise that decreased the probability of second MI after your first. But they tend to not look at the whole. And all six of these factors have tremendous synergy, either from a negative perspective, where if you don't sleep well, then you don't respond to stress as well, your relationships start to deteriorate, etc. Or, of course, you create that positive synergy. You have support in your environment, which makes it easier to get to your meditation pillow. And when you're meditating more, you sleep better, you exercise, and they all influence each other. And unfortunately, we look at them in isolation. Stress will actually impact how we metabolize food. We tend to think of just stress in terms of our mood and our sleep at best. But it actually will change how you metabolize food. And there's evidence to suggest that people who lead more chronically stressed lives have a propensity to maintain more weight. So we think about weight loss, exercise more, and eat less, right? Simple. You'll decrease your risk of Alzheimer's, of heart disease, of diabetes. But if you don't also talk about sleep and support, and environmental exposures, then you're not going to give the person the best chance to be successful in behavior change.
Thank you. Joanna, I'm really curious about these global annual conference roundtable on longevity clinics. And I know in Europe, sometimes they have a little different perspective than what we see in the United States and the Americas in general. So tell us a little bit about this. What are the main topics there? Are similar to what Mauricio and Lorenzo are saying? Are they different? What's going on that side of the world?
No, I'm very happy about this question because on one side, maybe in America there's a slightly different approach because of the regulations and what is possible and available. But actually, at this conference, we have people from all over the world, also clinics from Singapore, clinics from UAE, and of course from Europe. I think, and I like that both Lorenzo and Maurizio touch on the physical health, but also very much on the emotional health, because still on many conferences focusing on longevity, there is a lot of discussion on the science and on, how much progress do we do in terms of understanding how we age and why we age and how we can reverse it. But actually in the last 2 years, especially when you meet with other longevity clinics, which usually have doctors, which usually have psychologists, sleep experts, and also dietitians, we really try to cover many different aspects of health, as Lorenzo was saying, starting from physical health, of course, preventive medicine, understanding, the genetic predisposition. And we know, for example, I think this could be interesting for our audience, that only 7% of your genetic predisposition is actually influencing your longevity. 7%, which means that 95 or 93% is really up to our epigenetics, everything else that we do. And this is not only what we eat or what we don't eat and whether we sleep, exercise, but also, to Lorenzo's point, I think it's social connections, meditation, and also having a higher purpose, knowing actually, having this resilience and balance. So for the first time, also Rinpoche this year was one of the speakers, and we have included meditation, but also Rinpoche was talking both about meditation and sleep. And this was very well received because we were able also to present some of the research that you were leading, Alessandro, and it was something that this is actually very strongly appealing to scientists, but also to doctors, that we can show that meditation is not only about closing your eyes and thinking about whatever you're thinking about, but it's a very strong scientific base, that it's regulating your hormonal expression, is really influencing your physical resilience as well. And today, with all the diagnostics available for preventive health, but also for longevity, different aspects of biological ages, we can also test it and see the difference. Rinpoche has been very well tested in our clinics, and he's one of the healthiest people we have, actually. So I think and also every year this is improving, and I think this is very important as well for people to know that that longevity is really about keeping you healthy, but also not overdoing it. I like the aspect. Brian Johnson at the moment is popularizing this topic, but some people watching only this movie think that it's very hard and very expensive to do that. But to really focus on longevity, you can start with very simple changes like each and every one of us is mentioning sleep. I mean, this is an absolute baseline. I mean, of course you shouldn't smoke. This is obvious. And you should maybe try not to overeat sugar and not to overeat in general. But I think these are some of the basic stats of longevity. What we are also discussing among this conference, among doctors attending this conference, and we have Cleveland Clinic, Mayo Clinic, many other clinics that are well known around the world for their work in longevity field. Some of them are specializing very much in genetic predisposition and also different interventions. And some of us are very much in lifestyle, like Dr. Tin Ornish, for example. But what we need today is really common standards and protocols. And this is why clinics are meeting, because we really want to work towards having standards and regulations that we can recommend to various medical societies so that they could be implemented. Other doctors can be also trained in what is already available, what can we already do today, because in what I was surprised when I started working in this field, in terms of medicine, most of the medical schools are not teaching doctors anything about sleep or anything about nutrition. And and these are some of the basic recommendations that that we have, that are the simplest and actually the most widely available that we can use today.
Thank you, Joanna. And I may just say that the studies that you were mentioned, actually, most of those I did with Lorenzo. So I want to give credit where it's
Perfect.
um, also, Rinpoche, it's interesting how important meaning and purpose is in this. My sense is that you grew up with that. That part was the basis of your training. Um, and so that's one part of the question. And then the other is how you're seeing that your peers, uh, even though the meaning and purpose is there, the lifestyle that we see in the monasteries, and I'm kind of giving a preview of what the conversation tomorrow will be, but that in terms of diet and so forth, they might not be a par to what we are discussing here. So my question to you, Rinpoche, is kind of you grew up with this meaning and purpose. So if you can talk about that, and then how still with that you find that it's important to have the other components.
Sure. So I first of all thank you all of being here, Joanna, Lorenzo, Mauricio. Wonderful to have you all here. Thank you, Alex, for running, and hosting every evening instead of having a nice dinner with your wife and going out. You're coming here. I appreciate that very much. So, yeah, I think I'll just tell. I spent yesterday. I did not attend the conference, so I took my little brother up in the Nagarkot, and we were riding in the car. We were talking about, he's 19 years old. But it's not a blood related. My stepfather, it's a long story, but it's like my brother. So he just after a long time we got to sit together. He's only 19. My son is 19. My little brother is 19. So he's a monk. So we went to spend day together. We were riding up in the car, and we were talking about the sugar and diabetes, and because this is what topic that I've been interested lately. Tomorrow is the theme that we are talking about, the monastery diet, and many monks are sick with diabetes. So I was talking with him, and he said he was having some skin issues. Then his sister decided to take a test, and then he was diagnosed as pre-diabetic, 19 years old, monk in the monastery. So then I said, what is it? What's happening? Then he said, I could think of, it's not like it's Sampa, usually elder Tibetan people eat a lot of carbohydrate, the roasted barley flour for 15, 20 years. By 15, 20 years, eating twice a day, big volume in an empty stomach, I think you are getting to get diabetes. But 19 years old, getting pre-diabetes is like shocking. I said, what happened? Then he was drinking a lot of Coke and having ice cream because his mother was allowing him to do that, and he was enjoying it. But he was smart. He said, and he tested, and he pre-diabetic diagnosed for that, and then he really worked hard. Within 2 months, from his HbA1c was 5.9 or something like that. Then within 2 months he raised it 4.8 back so fast back because he's very young, so he could exercise and diet and everything. So the problem here is clearly, I think, as Lorenzo, you're putting out 6 point, or with Dean Ornish talking about the four points in medicinal lifestyle medicine. These all has to be together. You cannot separate them, and yeah. So I think this is tomorrow we are going to have this conversation about with some of the monks who already have diabetes or who have able to overcome it, and talking about one of our former health minister of Tibetan exile government who who have also learned a lot of issues in the monasteries, the diet. So I've been on social media, I've been talking about effects of the tsampa, the roasted barley flour, that is not good if you don't know how to eat and what amount to eat, when to eat. And it kind of went viral in Tibetan community when I am walking around in Nepal. "Oh, you are the guy who's telling us not to eat samba, ha ha ha," you know. So it's like a little bit, it's kind of challenging. But so I've met two monks that we here every day. I go to the gym and they come to the sauna here, talking about it. And I give my blood tester. I bought one. I gave them him today. He's sending. I'm not a doctor, but he's sending me all the report. What he's eating, what the blood test is, sugar level is, reporting it, so on. So I think it's really, really important that integrating all these things together. And one thing I wanted to ask to Maurizio and Lorenzo and all of you, it seems like sometime the way in the West that even like a level of sugar, fasting glucose level 126, if you have 126, then you're diagnosed with having diabetes. But until then, if you have may hand into something, maybe even the doctor will say, okay, not a problem, don't worry about it. But if you're trying to prevent something, you don't have to wait that long. It has to start much earlier. So it takes maybe 10 years or 15 years or 20 years to get it. Until you get it, you're in the West, it says it's okay. You're fine. The day you don't get it, now you have a diabetes. That it did not happen overnight. It took 5 years, 10 years, 15 years. So what are the solutions for finding a way to preventing these things? I mean, for me, myself, I don't have a diabetes or pre-diabetes, but clearly I I'm clearly wanted to say my goal is this year trying to age my cardiovascular aging 5 years lower and maybe a sugar level to stay with a lower end of range. That's my goal of the year 2025. That's my goal. So to have a specific goal to testing it again and again, we need to do something like that. Don't you think?
I'll pass it first to Mauricio since that's a lot of his area.
Thanks. No, I actually absolutely agree, Rinpoche. I think all these arbitrary definitions, they can help greatly for research purposes and for standardization between colleagues, but certainly on a patient level basis, they're not very useful. Being or not being diabetic, it's not black or white. It is actually a continuum. And I think the main problem is that the early stages of this disease, which is mainly insulin resistance, fatty liver disease, metabolic derangements, which can all be measured, some with more difficulty than others, but you can image the liver, you can get hormones, you can pretty much measure the waist circumference and have an idea of how the likelihood of you being in the process of developing diabetes or pre-diabetes or whatever you may call it. This is not defined as a disease. And in my clinical practice, I do think it's a disease and we treat it as such. I mean, we specify to the patient that they are actually sick, that there is a process going on which will eventually develop into diseases, and that you have to, take it as seriously as if you were sick. So that's one of the main parts of prevention is really being very aggressive from the beginning and not towards the end. Being aggressive when you identify these things, and it may be in your 20s, it may be in your 30s. So most of our guidelines, they're all asking for tests when you're 40, when you're 50, when you're sick, when you're getting tests and interventions when processes have already started. So on my clinical practice, we start early on and we're aggressive about the process and not about the final issue. That's too late. You got cancer. When you're there, you got cancer, you got disease, and we want to prevent that from the get-go.
Thank you. Lorenzo, we're thinking in the way that research is done, and you kind of alluded to it at the beginning. But in general, the golden standard of research, the RCTs, the randomized control trials, are all about what's the active ingredient. and then we're just focusing on one thing. But you've been really focusing on a more integrative approach, on a more, okay, it's not just one, but also we know how hard it is to find to get funding for that. So how do you balance in a way what you feel is the best in terms of research to support what we're talking about, and at the same time, find the results that actually the scientific community takes as evidence?
Yeah, I mean, that's hard. It's hard because the scientific model is, yes, you manipulate one thing. But what's interesting, in particular in the world of cancer now, is we know that one thing won't work in treating disease, regardless of what that field is. So just basic oncology, cancer medicine, it is almost non-existent now where a patient would receive one drug to control their disease. With what I do in the book Anti-Cancer Living is as Joanna said, all these lifestyle factors line up with biological processes. Well, we have multiple biological processes that keep cancer in check that are called the cancer hallmarks, and there's like 10 and 12 and now continually evolving things like the immune system, inflammatory processes, metabolic processes. Now the microbiome is classified as a cancer hallmark, and the microbiome is actually linked with all these non-communicable chronic diseases that we die from prematurely. And within cancer medicine, because now it is a multi-pronged approach, there's a treatment that will impact the immune system, one that impacts this particular genetic abnormality of the cancer, another angiogenesis, which is another cancer hallmark, even targeting the microbiome, that there's new models of doing the kind of research that we've always been doing within behavioral medicine, that now need to be implemented because there is not one drug for one thing. That's what, of course, pharmaceutical companies want. They want that magic anti-cancer drug and that the treatment, the single drug, but that's never going to be the case. And humans are biologically way too complex to think in such a reductionistic way. And in fact, cancer is so smart that it constantly is also evolving. And so then we need to figure out the new thing to give to the patient because the cancer, becomes resistant, just like people more familiar with in malaria. Uh, but I think to Mauricio's point of starting earlier, we actually need to start even at the time of conception because babies are being formed in an environment that even somebody who has all the best intentions set forth is polluted because our bodies are polluted with plastic. Our bodies are polluted with endocrine disruptors. This year's statistics from the American Cancer Society show that there is a precipitous increase in early onset cancer, women getting breast cancer in their 20s and their 30s, prostate cancer on the rise, colon cancer on the rise in people under 40 years old. This never happened in the history of humanity, and it's this sort of perfect storm of the mix of six, and in particular, I believe, and there isn't um, uh, solid evidence for this, but the environmental pillar. Why would somebody, to Rinpoche's point, at 19 years old, all of a sudden have pre-diabetes? It could be from all the Cokes and the ice cream, but probably not. It's probably that, the systems are different because of those early years that literally start at conception. And just like with cardiovascular disease and different blood measures that can be evaluated, the field of cancer is moving into a very interesting phase, which is being able to detect cancer at those early mutations. So there are these kits now that you can buy that are commercially available that actually look at circulating tumor DNA, as it's called, ctDNA, and it is in some sense scary because it's finding these mutated cells before there is any organ that we from the conventional screening perspective and scanning perspective can actually find cancer in the body. So you know that this person, it's almost like pre-diabetes. They have a pre-cancer. Well, now what are you going to do? You're not going to give somebody chemotherapy for a pre-cancer. We're not at Fantastic Voyage yet, where we could send in this microbot that goes and finds the 1,000 mutated cells and kills them. We have our own processes in our body, to shut down the cancer hallmarks that allow that first mutated cell to grow. So technology, there's two sides to the technology. One, you can detect something sooner, but then what are you going to do with that information? Big pharma, of course, will want to come up with drugs to control this. But we have, the power in our own hands to be able to take these preconditions and turn them benign.
Thank you. And I want to emphasize what you just said last. We have the power in our own hands. So I think this is a really important part of this dialogue. Joanna, I wanted to know more about this programs, longevity programs that you and your team design with positive psychology and neuroplasticity and sleep and lifestyle medicine. Tell us a little more about those programs.
I think what is really important also to design the program, and I think it was also mentioned by Lorenzo, we are so different, diverse. We are so individualized as well. There's another aspect, and also you mentioned hallmarks of aging. Most of our interventions, but also our diagnostics and the way we measure where we are and assessing the client's current state of health is actually based on hallmarks of aging. So whether they are, we look at microbiome, we look at your stem cells, we look at your telomeres, and a number of other different aspects in your body. We have a different program for men and women. One thing that we didn't discuss is the gender medicine. And women very often react very different than men to different medications on one side, but also, there's certain standards that were set in the past mainly based on male studies rather than female studies, which now in the longevity medicine we are trying to adopt it a bit. So first of all, we have to really assess somebody's current state of health, and this is both physical. We look at your brain, we look at your with your reaction time, with your also cognitive assessment, so that we can really personalize the recommendations. And then based on what somebody goal is, whether we don't try to change everything because nobody likes changes. We don't like other people telling us what to do, especially if they give us a long list of things we need to change. So we are starting usually with smaller steps. It's usually starting with self-observation in terms of your diet and making certain tweaks in your diet and the way what you eat, how you eat, whether you do intermittent fasting or not. I think Rinpoche mentioned also glucose monitoring, we do that as well as part of the program. And then other aspects, we also measure sleep, but not only with the traditional trackers, but also we have a brain lab. We can measure whether you have how your sleep quality is, and whether there's no possible risk factors connected with the lack of sleep. And then also we design a special diet recommendation on supplementation that is really personalized based on your blood results. And then your probiotic and prebiotic therapy based on your microbiome, on your food intolerances, on also other aspects of your metabolic health. And then your training. I mean, it's very important to train muscles because muscles is the most important organ for longevity. We want to be strong and resilient until late in life, but too much exercise is also not good for us. So we have to find the right balance between the right type of exercise, the type of life we have, and whether we are sitting most of the time during the day, so that we really implement some of the changes, like instead of taking the car everywhere, maybe we can walk, or we can take an elevator to the third floor, or we can walk as well. So exercise as well, but personalized. And then other aspects. I mean, we look at, we have psychologists, psychiatrists, emotional balance and emotional resilience is one of the most important aspects that help us to progress with our clients, because going to a doctor, usually the clients are coming to a doctor when there's something already broken and they want to fix it. In longevity clinics, we really want to address certain risk factors that are not yet converted into a disease. I think Lorenzo mentioned some of the markers for cancer. I mean, we are really looking in this field for finding as early as possible certain markers or certain changes in our biology that we can influence. Like we look at your arterial stiffness, for example, and if you start having problems in your veins, if you don't do anything with your diet and other lifestyle factors, then you might end up having a stroke or having other risk factors, cardiovascular factors. But in some cases, we have time to react, and in some cases, we have to intervene with medical interventions. So the programs are very personalized, based, and usually they are about 6 months to 12 months, so that you have also time to adapt. And depending really on somebody's personalized goal, what is important for them at this moment in time, whether this is losing weight or this is really feeling constantly tired, and we have to find the reason for that. We are so complex and interesting as humans. I mean, like, for example, being tired, there are so many reasons for that. We look at mitochondrial health, we look at your microbiome, we look at your hormones. Many of our clients have autoimmune diseases, for example, that were not addressed by doctors. And then we react and give a very personalized recommendations based on those results.
Wonderful. Thank you. Thank you. And also thank you for bringing this aspect of gender, which is really important, and of course of personalized.
Mm-hmm.
So and really finding the balance for that particular person. And in Tibetan medicine, one of the ways they call it's health through balance, right? To kind of bring you
Mm-hmm.
back to that balance. And Rinpoche, one of the ways that that you've been teaching about finding balance and sleeping better, and it's breath, and different ways of breathing more through the nose, of having the particular patterns at different times, of rebalancing sympathetic and parasympathetic systems. So if you want to say a little bit about that, and both in terms of how, the way I see what you're doing is both looking at what the text and the tradition says, but also your own personal exploration. So if you want to say a little bit about that.
Yeah, I can, you know, unlike Maurizio, Joanna, and Lorenzo, your clinics and doctors and researchers, and I'm none of that. So I'm only thing is the pieces of informations that I'm learning from, but I'm trying to engage very much on a personal level to that. As I said, I am goal of sugar level this year and the cardiovascular health this year. Actually, I have a question to Maurizio because I've heard one. I'll ask this question, then I'll answer Alex your point. So the question is that I heard that there were big research that within 2 years, if I remember correct, almost 10 years of reversing a cardiovascular age, reversing age 10 years in 2 years, 10 or more years in 2 years by a maximum, doing the maximum heart rate exercises. Basically, it's quite a lot of exercise um, involved in it during the week. So that I just wanted to ask that question to you because I'm kind of curious and interested on a personal level also. So again, going back to Alex's question, for me, it's for me longevity is it's hard to know all these different things. It's just I'm trying to do is one at the time. I'm very thankful, Joanna, for allowing the access to the clinic. This is the second year that I went did a thorough full checkup, and each time it was just very interesting, psychologically. First, a whole idea of do you really wanted to do that? I mean, I know people don't like to test everything; they don't want to know everything. So I thought, okay, I'm having this opportunity to do it. I should do it, and you check it, and then you wanted to know whatever it is before, then later. So knowing that, and then emphasizing on the sleep, they're like within a year and a half or something, I've really emphasized on the sleep, and I know that I have improved my sleep significantly. And then now I'm only focusing on that. So every time, not only working, trying to work on my own sleep, but every time advocating the sleep. Every strangers that I will meet anywhere, I will meet them. I'll make sure they sleep. Or from my son to my wife to students to anybody, I'll just so. One at a time, right? So yeah, I think one thing I realize is that when we talk about changes in a life, everybody have don't want to change. They're used to certain things. Tibetan lamas, they're used to eating sampa. They don't want to not eat sampa. They eat 3 times. How you can tell them, you know, not eat, or in the West, people I know that people love sugar and uh, pastries and all those things, and I don't care. I mean, all those section in the restaurant buffet, I'll just skip. I have no desire in that section, but I know others. I can see going toward that direction and debating in their mind, should I, shouldn't I, and so on. So in the end, all these fancy list of changes that we need to make, somehow, I mean, the idea of it cannot be very strong changes. It cannot be push. It cannot be forceful. Somehow there should be education. It's a joy. It's a different joy, But you have to learn. It always has to be joy. It cannot be. I don't think it's a wrong idea to saying you have to work hard. It's not. If you have to work hard, very good chance you will fail. But if it's a joy to working on something, then it's a very good chance you will succeed. So it's a diet change, it's a making a social connection, it is about exercise, it's about sleeping, it's about whatever you are trying to do, is reducing stress, whatever you're trying to do, all this means of doing it has to be joy, it has to be fun, has to be project. Like I've been telling my friends, I've been starting all these retreat centers. I'm doing all this teaching, everything. Now my focus is 100% focus on my health and help anybody what I'm discovering in this health. Just promoting and advocating this sleep or whatever it is, sugar or whatever it is, just because many times I realize culturally, like if you come to Asia, it's so difficult, so misunderstanding. In Tibetan community, there are so many people I've met, they're saying, eat more tsampa, roasted barley flour. It helps your sugar. If you have a diabetes, eat more tsampa. This is the message. And everybody believes in that. And everybody is living that life. So somewhere, thanks to all this social media, you have to bring some awareness to those particular community. Because in the West, there's so much information out there, but in this area section of Tibetan community in the monastery, they don't have with the language and access to those knowledge. So they need to get those information. So anyway, I think um, it seems like a really important to educate with joyfully. It's a joy to sleep. For me, it's a joy to sleep long. It's joy to go to bed earlier, joy to not get up early. And I really feel this. It was not always I felt that. I feel this now. And I know many people, they struggle, they don't feel that.
Thank you. And if I may, in the last retreat, we were in Brazil. What you asked everyone is stay 90 more minutes in bed. And then with that, you will be more relaxed and eventually sleep more as well. So I'll share that with everyone. Back to Mauricio, to the question that Rinpoche asked you.
Thank you. Yeah, so something I really try to do is to keep it simple and to try and present the evidence by the weight it holds. So I think, unfortunately, this is a wonderful field, but it does tend to not present the evidence at times in the order that it should. Maybe skipping all the way back up to really interventional treatments like stem cells and stuff, which are wonderful, but not talking about the basis of longevity and the evidence that it holds. And in that sense, if we're going to talk about reversal of cardiovascular aging, I think it's one of the most important aspects. And we do have evidence of reversal of cardiovascular aging, although how to measure this might be a little bit controversial. But if we're going to keep it simple, the strongest metric of longevity that we know currently is going to be your VO2 max or your cardiopulmonary function. So basically, that is the fitter you are, especially if you're in the top tertials or the elite status. If it's going to be 100 individuals, those individuals that are in the top tier will have the best outcomes longevity wise. And it's also true for the opposite. So being in the lowest VO2 max or cardiopulmonary capacity tertials is one of the strongest risk factors for early cardiovascular death, even stronger than many times smoking or having chronic kidney disease or being or many forms of cancer. And people don't think that way, right? So if you see somebody who's very old and fragile and they can't go up a flight of stairs, they still think that this individual is not sick. Actually, that individual has a very high mortality risk in the next 5 years, and he is very, very sick. Being fragile is not an absence of disease, right? So in Rinpoche's question, the strongest intervention that we have scientifically as of now would be in the form that if you are an unfit individual and you do an intervention and you at least becoming from being below average, you become average, or even better, from being average to above average, that will decrease your all-cause mortality by at least 30% or maybe even 40%, which in statistical terms is absolutely unheard of compared to any other intervention you can do. So,
yeah, so my question here, a little bit more specific, is Like for example, CO2 max. So training. So I know personally, I have been going for gym 4 or 5 times a week for last 10, 15 years. But I've never trained my CO2 max. I have never trained my zone 5 very much. I mean, I might go there, but it's not like a systematically. I would not say it. 3 times a week, I'll go up to my maximum heart rate, even more, stay there a few minutes, come down, rest a few minutes, do it 3 times in one session, do it 3 times a week. In that kind of very systematic training your CO2 max to maximizing your reversal of, I don't know, this is what I heard, up to 10 years or something like that within 2 years of doing those training. That's my specific question. Do you know any research? Because I'm sure I heard that, but I don't recall, but I will, just curious your thought about it.
Yeah, yeah, absolutely. And that's to the point I was getting to about being fit or unfit. If you change your category for VO2 max, if you go up, all metrics of cardiovascular health will improve. Now, that type of date related stats are very good for patient information. They can really interiorize that. If I tell them, listen, your cardiovascular age is 30 or 20, or it may be 70 or 90, that is very good for patients. They can actually put this into concept. But saying that is highly controversial. I mean, how do you come to those conclusions? I think are still debated. But even then, we do have epidemiological data, sorry for my English, that if you are highly fit, if you are in the top tier, definitely, I mean, becoming from being unfit to fit, it is related to reversal. Now, how to do that, you do have to become a little bit technical, and I can certainly help you on that. But for example, I don't know, cyclists, marathon runners, anybody that's tried to do a marathon at least, has to go under a certain program. And that program typically involves doing a lot of low intensity miles, meaning zone 2, zone 3 training. That might be walking briskly or going up hills or running gently, but you do have to put in at least 20%. So that's the 80-20 rule. You put in 20% of very high intensity interval training or something that is closer to your maximum heart rate. And that is something that's very interesting because I find that many populations are afraid to going to high intensity heart rates. Many populations really avoid that, especially older women, for example. I find that to be very challenging to do high intensity interval training, although they would be the most benefit from, because that is also related to musculoskeletal health. But yeah, you can definitely improve your VO2 max. It does require a little bit of planning and training, but that is one of the most valuable things you can manipulate, if not the most valuable. I mean, statistically wise, it is the most valuable metric from a cardiovascular standpoint in its relation to longevity.
Thank you.
Thank you.
Lorenzo, I'm thinking, and Joanna mentioned emotional balance. And I know in our research, one of the things that we find is that um, it's we know and the patients know what is best for them. And we tell them and we give them the tools and so forth. Yet, there are barriers. And in some of your research, what you started adding was health psychologists to support how do they go beyond the barriers? How does that one, how do we change? How do we change our habits? Like Rinpoche is saying, in the Tibetan case, eating sampa, in the Italian case, eating pasta. But it's not about the pasta, it's about how much and how often, right? So, if you can tell us a little bit about this, helping the behavioral change through health psychology and other tools.
Yeah, I think that that's ultimately the key, and Rinpoche actually touched on it, not surprisingly, before you even brought up the topic, which is, well, why are you doing this, right? If you're making the change so that you can live longer, that's probably not a sustainable goal because it's a very abstract concept. If you're doing these changes because you want to look better in your bathing suit that's upcoming summer, that's going to be short-lived, and you may lose the 10 or 20 pounds, but then it's going to come back on. So you have to bring it back to why is somebody engaging in these healthful behaviors? And behavioral counselors and my wife, who's now a wellness coach, focuses on this in particular with their clients, which is, again, the meaning and the purpose, and helping people to establish their core values, and aligning your behaviors and the way you navigate the world so that they're aligned with their core values. And core values isn't looking good in a bathing suit. Core values isn't, being less stressed, right? There's something bigger. And feeling joy, it can be often somebody's core values. Spending more time with family and friends can be, and is often listed very high in a core value, so that you want to get healthy so that you can be there for your grandchildren, not just to abstractly live longer, but to live better. And I think why it's so important to have things like mindfulness is not just because if you do deep diaphragmatic breathing and certain movements from movement-based mind-body practices, that's gonna, make the amygdala smaller, and change gene expression pathways, inflammation goes down, etc. Increase in parasympathetic tone. All those biological things are great, but it's also going to make you more aware of yourself and the way you feel after you eat a high sugar meal. Sure, the first 2 minutes is wonderful, just like when somebody, is taking an addictive drug. The quote unquote high is something they like, the samba, the big plate of pasta, right? You're getting this spike of dopamine in your brain with these high carbohydrate foods, a high salt, high fat, but it's short-lived. And if you're teach people mindfulness, mindful eating, mindfulness in all aspects of interacting with their lives, they will actually gravitate to things that are good for the brain. And to Joanna's, work in and around the concept of the brain and neuroplasticity, our brains have been hijacked from a very young age. And these unhealthy pathways of in particular sugar, the high, and that dopamine surge that happens with the high sugar food. And if a kid's exposed to this at 2 years old, then they start to crave more. Then that highway of addiction becomes even stronger. So to be able to shift away is very challenging, and all of these maladaptive, unhealthy behaviors, you can more often than not look at them from an addiction perspective. Even unhealthy relationships you can look at from an addiction perspective, and both the positive and the negative that they can get from that. So it's breaking the cycle is really, really hard. Breaking a sugar addiction and alcohol addiction are not too dissimilar. But we don't think of food in that way. We think of food as, you just have to have enough willpower. You have to want to lose weight more. And it's much harder than that. So I think aligning and understanding this from a psychological perspective, and how the psychological perspective again has hijacked the brain, it doesn't make it easier, but it also gives people permission to realize that this is hard, and it's not just about your willpower. And if you end up, you know, falling off the wagon, so to speak, and eating things that you shouldn't, that you're a weak person. This is a huge societal thing, and trying to, again, coming back to Rinpoche's comment about joy, aligning it with how you feel, that you ultimately are going to feel better, regardless of whether you live longer or not. People say, well, I don't want an extra 5 years of life if that means I can't eat my sugar and my hamburger. But do you really feel good after eating sugar and that hamburger? If you're not mindful about it, you'll say, yeah, I feel great. But if you're really mindful about how that makes your body feel, you'll realize that you're going to feel better after a healthy meal, after a healthy interaction with people. And I think that, this whole focus now, more so, I think, in certainly with millennials, and in particular with the next generation, the Gen Xers, they are starting to navigate the world with more meaning and purpose. They want to work for companies that align with their core values and with meaning and purpose. We're at an all-time high in the consumption of non-alcoholic beverages, and guess who's ordering them? It's the Gen Xers. It's not our generation, right? We still want the martini and the beer with alcohol. But they know that they don't feel good the next day, and that so it's an interesting shift. I think it all has to ultimately come back to living from a point of joy. But the only way you can know joy is if you start to be introspective and mindful about your life.
Yeah. So I'm going to come back to that. But actually, I I want to ask Joanna about the gender medicine, and particularly, of course, by the gender that is less researched and so forth, which is women. And what are you seeing in that area?
I mean, this was very, very interesting to us and to me also. What we, with my doctors, have actually, what we are investigating at the moment is, and this was very, very new to also many of the doctors, because they didn't really look at that many of the drugs that we are taking, like from painkillers to others, were generally tested on men. So as a result, women are very often highly over-medicated, because some of those medications were actually designed and tested mainly on men. Why? Because women have cycles, we are much more unpredictable. It's more difficult to test, especially in the past. I think now this is also changing. The regulations are slowly changing. But this is not only with medication, this is also with all sorts of recommendations like intermittent fasting. Women react differently to intermittent fasting than men, depending on our cycle, especially if they are still in the, let's say, premenopause, if they are still have their own cycle. Then there are certain days that are much more difficult for us to start the process of change than others. So we are now preparing actually a book on that, where we have divided, we are describing exactly the cycles in women's 28 days, on how you should actually exercise, how you should supplement, when you should start actually your intermittent fasting if you want, so that it's easier for you and it's in line with your system. And the same with what decisions you take. There are certain days in your 28 days of cycle that you shouldn't make any life decisions. You should maybe wait a few days. Of course, this can be considered to be very negative, but it's actually our biology. And this was actually very interesting, and this is one of the recommendations that our doctors definitely are including in our protocols for women. But also with all those recommendations about training and exercise, we try to do it very personalized based on where you are. I wanted to touch on something we didn't yet cover and I think it was mentioned by Lorenzo, about how early we should start with the changes not changes, with mindful living. It's really, we started introducing also in my clinic programs for kids, because we have seen that we have men and women coming and seeing this change and seeing really positive changes in their life. And then they started asking about kids. Because you can really already do a lot when with your kid, with 6, 7, 8, to really understand their genetic predisposition, to understand their microbiome, so that you can also teach the kids on what they should be eating and why. And I love the comment about the non-alcohol aspect. I mean, this is something that I really enjoy now being in Middle East, that nobody asked me whether I want wine or not, and I didn't have to explain why not, because I just, I never liked drinking wine because I don't like feeling sleepy the next day. But now the new generation it's actually not even thinking about this. They are much more mindful. And I think the earlier we start teaching at school, what does it actually mean, microbiome, mitochondria, how is it affected with, whether we exercise, what we eat, and how does stress and sugar impact our biology? I mean, when we see it, it's much easier for us to react or to implement the changes. I think we should really start with more um, teaching, changing curriculums at school so that we don't learn theoretical topics like mitochondrial health, which is not really connected on what to do with that. I think it's something that we are now doing actually in Europe, in Poland, and also in Switzerland, trying to introduce more and more of those topics into schools as early as possible. But I think this is something that definitely we'll be focusing on going further.
Thank you. And thank you for talking about that, because Sona was asking about that in the chat. And so there you go for how do we address for the younger generation. I know we are about to close, but a topic that was touched, and I know for many is controversial, which is alcohol. And as we know,
Not
many,
controversial. It's not
well,
controversial at all.
well, exactly. But as you know well, Lorenzo, we have many friends and many people that even with cancer, having gone through that, they think of alcohol as moderation is okay. And moderation might even be, well, a glass or two a day. So I'll start with you, Lorenzo, because I know what you think, and yeah, and go for it.
Yeah, I mean, we kind of give a hall pass to alcohol because it's so ingrained in our world and society. But from a cancer perspective, and Mauricio can talk about it from a cardiovascular perspective, because that's where actually the data has really shifted. From a cancer perspective, the message was moderation. It is a carcinogen, right? So there's that acknowledgement. The definition of a carcinogen is a substance that causes cancer, and there are many environmental carcinogens that have been banned from the products that we get exposed to. There's still many out there that haven't been banned, which includes, the PFAS chemicals in our drinking water. At the right dose, it's a carcinogen, but it's a carcinogen at any dose, right? And so alcohol is a carcinogen at any dose. Now, a higher dose and a higher frequency is going to increase its carcinogenic potential, meaning causing these mutations and the whole process unfolding. And so the one a day for women, two a day for men. I mean, two a day, 7 days a week for decades. You just think about it. That's not, you're drinking a
Mhm.
carcinogen every day. Smoking is a carcinogen. We don't say, well, if you only smoke, 2 cigarettes a week, it's probably okay, right? The American Cancer Society has never said that. And so now they're stepping back and not saying that with alcohol. They're saying alcohol is a carcinogen to reduce your risk more. Don't drink, right? And that's really the message. The mixed message about cardiovascular disease is, people are trying to understand the European paradox. They pin it on the French, but the Italians, the Spanish, lots of fatty food consumption, lots of wine consumption, and they didn't have a lot of cardiovascular issues. And the research was somewhat flawed, showing that red wine in and of itself decrease cardiovascular risk. And there is a link between cardiovascular disease and alcohol consumption. Again, it's this inflammatory issue, similarly linked with Alzheimer's. Alcohol disrupts sleep, etc. So yes, of course, moderation, just like with sugar, we're not going to be able to ban sugar. We're not going to ban alcohol like was done back in the Prohibition time in the US. But people need to know that it it's linked with cancer, and it's linked with some cancers in a linear fashion.
Mauricio, I know that as Lorenzo kind of alluded, there's this idea that red wine, the resveratrol, can help in the heart, and that was kind of the excuse in a way to support that. I mean, what you see in your field, and now that the FDA in the US, it's actually saying, hey, finally, it's saying, yes, it is a carcinogen. It is deleterious to your health. So, Mauricio.
Yeah, I first of all, I really like to put the evidence by its scale and by just how much you know about things. Again, VO2 max, those things we know. But food, looking into food is the most challenging thing of what we do because it is so flawed and it is so hard to really, study these things. Eggs, for example. My God, eggs have been studied for so long, and they've come back and forth. Same with alcohol, same with coffee. So you just have to acknowledge that it is incredibly challenging to do these things. Now, what I do think is a constant is that we've shied away from the recommendation that drinking might be good for you. I think that is something that we are gearing away from, and I think everybody can agree on that. I mean, we don't tell people go ahead and drink, and it will give you benefits because of doing that. So that recommendation that drinking moderately or whatever is truly flawed, and I think people are shying away from it, and it's not good. But on the other hand, we do have to treat patients. We have to talk to people. So if you have an elderly man and you tell him, listen, you have to do sprints, you have to lift weights, stop drinking, sleep 8 hours. It really, you just have to do things in a stepwise fashion. So if the individual you're talking to drinks a lot, then you start there. Then you really just start from there. The drinking is the worst problem that you're having. You really have to cut that. That will help your metabolic health. That's why you're depressed. That's why, many other things are but if it's a person who is highly unfit and maybe he drinks socially on weekends, then that's not the priority. That's how I take it on a clinical basis. You start with the hardest problems or the most, and then you work your way up into more technical issues. Or okay, let's talk about sleep and stuff. So you start from the most important, and then you work your way up. But I think from a population based recommendation, this drink a little bit will make you better. We are certainly shying it away from it. That's the beginning, and we'll see where I mean, it is hard. So many cultures have this ingrained into it, right? And even we can go into really new little details. Like, for example, it's not the same to drink with a meal, like many people do in European countries, than to binge drink on weekends, right? There's two whole different, and it's not the same drinking a very good quality community wine, from your own farm than drinking, I don't know, rum and coke. So all these things, right? They make it so hard to study. And I think what we have to be as a community is just being honest about what we know and what we don't know, and putting that into balance.
Thank you, Mauricio, for bringing that nuance. Joanna, I see that you're unmuting, so I feel you're trying to say something there.
I wanted, yes, to comment on that. I mean, in general, we are also recommending not to drink because it's also a lot of sugar. But on the other side, these are humans, and I think, as Mauricio said, and it's not so black and white. So one of our psychologists also nicely said it, that if this is really a ritual, then it's a different way than having a need to drink, and also trying to drink because somebody is lonely and feels depressed and tries to elevate their mood. And I think this is I think if this is a ritual, they see it as a more positive, and also you see it with this Blue Zones recommendations. But in generally, I think it's also what Mauricio said. It's the reason why you need to drink, and why can you not actually find a different way to manage your emotions.
Yeah, if it brings you joy. So, Rinpoche, I think we are in the closing, so the word is yours.
So what is it, Alex?
I mean, we are about to close. I don't know anything else that you want to add.
Oh, you mean general?
Yes.
Yeah. So, yeah, I don't know. It was very interesting, all the themes, a lot of information to digest. So I'm very happy that we're having this very exciting conversation. I hope we can do again in the future. Yeah.
Thank you. Anyone else that has something else that you want to add before we close?
I think one thing that also Dean Ornish said at our event, and I think it's worth to remember why we are doing what we are doing, that longevity is really not about the fear of dying, but the joy of living. And I think Rinpoche also mentioned something very similar.
Thank you. Thank you, Joanna. And, actually, Dean Ornish, for a long time, was in Houston, where all of us at some point, I know Lorenzo, Mauricio, and Rinpoche and I were at some point. I'm still, but yes, and Lorenzo in a way. So anything else, Lorenzo, Mauricio, anything else before we close and I announce tomorrow? Okay. So
Thank you for the opportunity. I always enjoy it.
thank you. Thank you. It's been fantastic. Thank you so much, Joanna, Mauricio, Lorenzo, Rinpoche, and the whole team behind. So tomorrow, I think it's going to be so interesting because I don't know that this topic has been done in public before, or even in small in non-public, which is Rinpoche tomorrow at same time. Actually, no, a little later.
Alex,
10
you're free tomorrow.
I am free. No, I am free. But you so basically it's 10:15 New York time, 9 a.m. Nepal time. Rinpoche will talk with um, a, a couple of Tibetans, Chopet Paljurt Sering, Geshe Dangson Namgyal, and Geshe Tenzin Yangtun, as well as Yundung Wasa Gurung. He will host this panel on sacred balance, transforming monastic diets for health and spiritual well-being. It will be in Tibetan. Hopefully AI can help it with having some translation because I think it'll be incredibly interesting and may have some repercussions in how things change. So thank you, everyone. Thank you for listening. And this will be recorded. So it's there if you want to hear it again or share it with your friends. Thank you very much.
Thank you. Thank you, everybody.
Thank you so much.